Okay, Brittany, is
Yes.
it okay if I record this for training purposes for new faculty members who will be doing capstones?
Yes.
All right, thank you very much. All right, so you are doing your capstone in the labor and delivery unit at IMED,
Yes.
and I see that the unit requested you. Do you work there as a tech right now?
I don't know. One of my friends, she works there, and so she wanted to request me because she knew that I was interested after I graduate to be an L&D.
Okay, cool. Is your friend your preceptor also?
No.
Okay, that's probably a better thing.
Yeah.
Um, so you're doing L&D, right?
Yeah.
Just L&D. You're not doing any peripartum stuff other than L&D.
Yeah. Just L&D.
Okay, very cool. Um, so the purpose of this meeting today, Brittany, is to kind of make sure you're set up for success with your capstone. I'd like to give you an opportunity to ask any questions that you have, and then I'd like to just go over a few things and make sure that you're aware of all the expectations of how to be successful.
Perfect.
So with that in mind, do you have any questions for me?
Not right now, no.
Okay. Excellent. So, are you wanting to work in the labor and delivery unit there after you graduate, or do you know yet?
Ideally, I would love to.
Okay, we'll talk about some strategies that can help make that a reality.
Okay.
Because you probably know this already, but you are in a capstone that is like highly sought after. For some unknown reason, I don't get it. Every young woman going into nursing wants to work in labor and delivery.
I know.
I just don't understand. I'm kidding. I totally get it. It's but it's highly sought after. So we're going to talk about a few things you can do to help maybe differentiate yourself
Okay.
and so set yourself apart. We'll get to that in just a minute. Um, all right, your SMART goal. Let's start. Oh, yeah. Did I already ask you? Do you have any questions for me?
Yeah, you already did. I'm good.
Okay. All right. So if you do have questions as we go through this, just shout them out. Okay.
Okay.
All right. So your SMART goal by the end of your capstone, you want to gain more confidence in reading fetal heart rate strips and how to accurately chart them, as well as reading contractions. Now, is that the TOCO strip? Is that the
Yeah.
contractions? Okay. I never knew what TOCO stood for. What does it stand for?
I don't even know, honestly.
Okay. I'll have to ask Dr. Google. Keeping mom and baby safe, as well as focusing on your nursing skills and getting more confidence in those as well. So,
Yes.
how do you think you're going to measure all that, whether or not you're successful?
So my preceptor is really great with helping me with fetal heart rate strips. We sit down pretty much every time we come out of well, we have to chart obviously every
Mm-hmm.
hour, every 30 minutes, every 15 if they're on Pitocin. So we get to do a lot of fetal heart rate strips. So that's super helpful. Um, she's like leaning me towards like more into it. This last time on Monday when I went, she just let me chart and then kind of sat back and helped me if I was struggling with some areas. So that
All
was
right, cool. So let's see. You've worked how many shifts so far? You've worked just one full shift in your orientation shift. Is that correct?
yeah.
Yeah, and then you've got another shift on Friday. It looks like.
Yep.
All right, cool. Um, I like that. I like the fact that you want to focus a little bit on safety too,
Hmm.
because that's what I'm passionate about is keeping our patients safe. So,
Yeah.
fantastic. All right. Um, let's talk about your schedule for a minute. So weirdly, you have 1.5 hours too much on your
I know.
schedule. So we need to clean that up a little bit.
Okay.
Okay. So go in, and I see that half of the your orientation shift, you have 5 hours there. Can you change that to 4 hours?
Yes. How
And
do I
it's,
do that?
I don't know, you have to do it in exact, just edit it. You should be able to.
Okay, because it says pending review, so I don't know if I can't click on it and change it.
Oh, okay. Maybe I can change it out of pending review.
Sorry, I didn't know if I went over, I still put in that time or if I just go strictly to that time.
Let me see. Da-da. What in the world have I done now? Oh, maybe I do that. Okay, I'm gonna not approve that.
Okay.
And let's see if that does a difference there. If that sends you a note. I don't know. I've never had to do this before. And then the other thing is on the 10th, yesterday, if you can also
Change it.
please, yeah, change it. Put in a half an hour lunch because you got 7 to 19:30.
Okay.
And if you put in a half an hour lunch, then it says, please enter comments. Where do I enter comments? You tell me. I'll add comment. Are you logged into that right now?
I am, yeah.
Cool. So maybe you're able to fix it. I'd love to know.
Oh, I can change it. Sorry.
Okay, cool. Okay.
Quick.
So you're able to change it now after I didn't approve it.
Yes.
All right. And just to let you know, you don't have to change it to awaiting approval because we don't actually ever go in and approve these anyway.
Okay.
This is just for our tracking purposes.
Okay. Those should be fixed on my end.
All right. I'm going to just refresh my screen and see what it looks like. Holy cow, it's asking me to log back in now. That's weird. Yeah, it's not all that weird, actually. This tracking system we use has some funny quirks to it. Yep. Okay, cool. Fixed. Love it. Love it, love it. Okay, so continuing on with the schedule, it appears as though we need to have our midterm between or after June 15th, but before July 2nd.
Okay.
And we're going to want your preceptor there in
Yeah.
that meeting as well. It's preferable if you do it when you're not at the unit.
Okay.
So if you can do it at home, just sometimes invariably things happen where you're going to be like, oh my gosh, we have to take your patient for an emergency C-section. And then your preceptor gets up and runs off to do that. And then it's like, we're having a conversation here, but obviously they can't just ignore the patient.
Right.
If you do need to do it during a shift, see if you can get off the floor and go somewhere that's completely not, so that you won't be have any interference from work.
Okay.
All right, cool. Wow, your first full shift. Well, let me ask you this: Did you
Yes.
do any clinicals in L&D?
I did one at LDS hospital.
Okay. That's a different story though, because you were
Yeah.
probably mostly observing, not expected to do anything.
Yes.
Kind of lame. So you had this emergency C-section for a placental abruption.
Yeah.
I'll bet that kind of freaked you out a little bit.
Honestly, I'm surprised that I didn't freak out. I was just it was just a weird situation where she wasn't showing any signs that her placental was abrupting. And we took her back because baby's heart rate was down for like more than 20 minutes.
Yeah.
If we could get it under control in the OR, and we didn't. And they cut her open and she started bleeding. And they're like, this
Oh my
is
gosh.
a abruption.
Well, I'm glad that
Yeah.
that she was where she was. I mean, that makes all the difference. Think about 60 years ago, that would have been a dead mom and a dead baby.
Mm-hmm. Funny
it's
thing
amazing.
is, the baby was totally fine. They did the baby's ABGs and everything. Perfect.
Nice.
Yeah.
Well, cool. Well, you might have had a dead mom anyway.
Yeah.
So that's good. I liked how your role in that was you were making eye contact with mom, telling her that there was some anomalies with the strip, and we just wanted to be certain. And then after you got her calmed down a little bit, you went and updated dad.
Yeah.
Strong word. That's
Thank you.
cool, especially for like your first capstone shift, to have that kind of calm coolness about you is pretty impressive.
Thank you.
Because a lot of people would have been freaking out. And if you're going to work in L&D, you're probably going to see this 100 more times in your career.
Yeah, I agree.
And other things,
Mhm.
other, because that placenta, it causes all sorts of problems, doesn't it?
Yeah.
So, okay, cool. Your evaluation, the preceptor has some great things to do or to say about you, just you're so helpful, a great listener. You only have to be shown how to do things one time. That's nice.
Yeah.
Just need to get more experience.
Yeah.
Um,
It was a little bit, I didn't, she kind of was, she's on the stat team. So that shift, it was kind of crazy doing everything. There was a lot of stat calls with emergency C-sections and everything like that. So she did the best she could explaining, but also being present in the moment and helping out immediately when she needed to. So,
cool. What is how many patients do you have when you're in full census?
so we have 1 to 2 usually.
No, I mean in the whole unit.
Oh, the whole unit.
Yeah.
It's kind of crazy right now with a bunch of moms coming in. Monday we had, I think, 15 plus the moms that stay there
Wow.
due to complications during the
So
pregnancy.
how many beds do you have on the unit?
There are, I believe, 6 to 7, I think, in each pod, plus 2 triages in each pod. So,
Wow,
yeah.
nice. So is Cottonwood Hospital still doing labor and delivery?
I'm not
Or
sure.
what's Tosh now? It used to be Cottonwood Hospital
Yeah.
because they had a really nice L&D like area.
Yeah.
Okay, all right. So it sounds like things are going well. Do you have access to charting?
Mhm.
Good. Have you been charting? Did you chart on your first day?
I did chart, yeah.
Cool. All right. Any questions to this point?
Mm-mm.
All right. There's 3 things I want to talk to you about
Okay.
that might be challenging for you. They're challenging for some students, but not all students. The first one is giving report at shift change. How do you feel about that? Is that intimidating to you? You feel comfortable with it? Too soon to tell?
Um, it's a little bit intimidating. When we were doing shift change on Monday, I kind of jumped in where she kind of left some things out because we were both had papers that were written down on our patients.
Mhm.
So I'm not scared to do it. It's just a little bit intimidating, but I think I will be okay once I do it officially. So
Cool. So speaking of papers to write things down, do y'all use the same standardized brain,
mhm.
or does everyone create their own style?
They just have 4x4 note cards that we write down
Oh,
patient
okay,
information with. So
okay, cool. So that's going to be your lifesaver. If you don't know that by now, that's going to be your lifesaver for taking care of your patient and for giving a report.
yeah.
So if you are intimidated by it or struggle with it, here's my advice to you: is that early on in your capstone, that 30 minutes before shift change, that you stop doing patient care altogether. Your preceptor is competent and completely able to take care of a full patient load without you.
Right.
Um, and then just sit down and pick one of the patients and write out a report
Okay.
about what you're going to say, and then run it by your preceptor. Like, here's what I'm going to say during a report. What do you think? And get some feedback. Because this is one of the skills that you're going to have to absolutely master as a nurse,
Yeah.
is that communication with other care providers.
Mhm.
Speaking of, how much interaction opportunity do you have to talk to the physicians?
We did a lot on Monday, so it's kind of nice. We can page them or they're usually nearby anyway due to the moms giving birth, or yeah, we can message them in Teams too. So
Okay. Do you feel comfortable doing that?
yeah.
Okay, cool. That's another skill that a lot of people are intimidated by, is going up to a physician and saying, "Hey, my patient's in pain and we need some oxycodone."
Yeah.
Just or anything, asking for anything that can be um, challenging as well. So keep doing that. Sorry, just making some notes.
We good.
All right, and we'll talk about that at the midterm. We'll talk about how you're progressing with giving a report and how it's been with you communicating with the physicians as well.
Perfect.
All right, next thing I want to talk to you about is getting a job there in this highly competitive area. Do you know who the unit educator is?
Yeah, I actually talked to her on Monday. She came in
Oh,
and introduced herself to
good.
everything. So
I love that. I love it. I love it. I love it. Do you know who the hiring manager is?
I don't know.
Okay. So here's my advice to you, and you do with this whatever you want.
Okay.
But you want to set yourself apart somehow, right? The way that I would recommend that you do that is with both the educator and the hiring manager. Ask, you've already talked about to the educator, so cool. But you can ask the educator one question. Hey, say, I really am interested in working in this unit after graduating. What can I do right now during my capstone to make myself the ideal candidate for this job? Right?
Yeah.
And then ask the same question to the unit manager. Introduce yourself, ask any questions you have about like overtime requirements or on-call requirements, weekend requirements, night requirements. Get to know that. That shows an interest. That shows them that you're really interested in it. And then if you hit them at the very end with, what can I do to make myself the perfect candidate? That's like a 1-2 punch. I'm interested in this job, and what can I do? And then when it comes time when they have an opening, you can approach the manager and say, hey, you gave me this list of things that I needed to work on to be the perfect candidate. Here's how I have addressed them.
Yeah.
Right. And that shows initiative to them. They're going to put a name with a face. We've had some really good success with that strategy, especially if you do it early on in your capstone.
Yeah.
Because if they know that there's going to be a position open, they might just start looking at you like with a fine-tooth comb under a microscope, and it might turn into a 100-hour interview, basically.
Yeah.
So
Yeah.
anyway, you do with that what you will, but it has been successful for some students.
Okay. My
All
patient
right.
actually said that they're short-staffed right now and they're looking to hire. So
Okay, cool. So then what you want to do is you really want to plant this seed in the manager's mind,
yes.
right? Because she'll start looking at you like, huh, I'm short-staffed. I have the opportunity to mold somebody right now into exactly what I want them to be.
Yeah.
So cool. In fact, they might even tell their unit educator, hey, keep an eye on Brittany. Follow up on her, see how she's doing, just like they would if you were a nurse apprentice.
Right.
So, all right, cool. That's awesome. Let me know how it goes.
I will.
Well, I'm sure I will ask you anyway at your during your final capstone meeting. I will ask you how it went. All right. Do you have anything on your mind that you need to talk to me about?
I don't think so. No.
Okay.
Sorry, my next meeting with you, it has to be, so she has to be there, obviously, and then before my July 2nd meeting.
Before your July 2nd shift.
Okay, I was just gonna create an appointment after my 21st shift. That way it's just done and blown out the water.
Perfect. I love it. I think there are some openings now. I don't think there's much beyond that.
Okay.
Just because we only do 1 to 2 weeks ahead of time with our schedules.
Okay. And before we got on, and there was only the week before the 20th.
Okay. I'll probably populate the next week's dates tomorrow.
Okay.
And then before your midterm, you also need to complete 2 additional goals.
Okay.
And it doesn't matter which ones you pick. All right. Well, if you do have any concerns or any questions or anything you need to talk about, there's 3 ways to get a hold of us. And when I say us, I mean Hannah Winter and myself. We teach this course together. We work very closely together, very well together. We talk about capstone students every day. Just check in, see if anything needs to be done. So message us in Canvas, both of us, and whoever can address the situation first will. Okay. If it's something of a more urgent nature, please text us. We have included our cell phone numbers on the homepage of Canvas. And once again, text both of us and introduce yourself. We've had texts before. Hey, I'm just having a needle stick. What do I do? And it's like, okay, who is this first of all? Yeah. Don't call us. We won't answer. I promise. And then the other thing you can do if you want to talk face to face is just schedule one of these appointment slots. Doesn't have to, it doesn't have to be an official check-in meeting if you just want to talk about something.
Perfect.
All right. Okay. Well, if there's nothing else you need to talk about, I will thank you for your time and wish you the rest of the day. I
Thank you.
wish you a great rest of the day.
Thank you. You too.
You're welcome. Thanks. Bye-bye.
Okay.